I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor. In this video, I'm going to help you understand how insulin works. This is an important concept to understand if you're suffering from prediabetes or type 2 diabetes or polycystic ovarian syndrome or type 1 diabetes. You'll find that in people with prediabetes or type 2 diabetes or polycystic ovarian syndrome, there is excess insulin levels and thereby causing insulin resistance, thereby driving increased blood sugar. However, with type 1 diabetes, there is insulin deficiency, and sometimes people can have both type 1 and type 2 diabetes. So basically what that means is that, so they start with type 1 diabetes, but then because of their changes in lifestyle, they eventually become insulin resistant and thereby needing more insulin to control that blood sugar. Anyway, once you understand how insulin works, then you've taken the first step to control your blood sugar. So without further ado, let's get started. So insulin is an anabolic hormone. Basically it means that it builds tissues. So too low of insulin is bad, as well as too much of insulin can also be bad. Our blood sugar tries to stay between 70 to 140 milligram per deciliter. When our blood sugar goes low, our stress hormones called as the cortisol and the other hormones called as the glucagon, it tells the liver to pour some glucose into the blood. So these hormones also helps to burn fat for energy if needed. So the insulin always makes sure that it keeps in check to make sure that the fat is not being excessively burned to produce too much of ketone bodies. Ketone bodies are good, they are a good source of energy, but then too much ketone bodies can actually develop a complication called as ketoacidosis. Again, this is going to be uncommon in normal people. However, in diabetes patients, when they have a completely lack of insulin, especially in type 1 diabetes, they can develop a complication called as a ketoacidosis. In addition to that, the insulin also keeps a check on the liver. So let us say if the liver is not behaving properly with the insulin, then the liver starts to pour too much glucose in the bloodstream and thereby causing your blood sugar to increase. So there's always circulating insulin in our body at a low level, keeping this in check so that not too much ketone bodies are being produced. As we mentioned now, in type 1 diabetes, because of complete insulin deficiency, these ketone bodies production may not be kept in check, thereby resulting in the risk of diabetic ketoacidosis, which is a very dangerous complication. Unfortunately, I've seen a handful of deaths because of this condition in my clinical practice. So the diabetic ketoacidosis is a rare complication in type 2 diabetes. However, in some people, they might have severe insulin resistance, where it basically means that these fat and the liver tissues are not obeying insulin at all, and thereby it results in the increased production of ketone bodies and thereby resulting in the increased risk for ketoacidosis. So when we eat food, our blood sugar goes up. When we are stressed, our blood sugar goes up. Our pancreas will produce insulin to keep our sugars under control between 70 to 140. So what this means is that in a non-diabetic person, let us say if he's under stress, maybe due to poor sleep or work stress, his stress hormones will increase his blood sugar. However, his normally functioning pancreas will keep his sugar under control by producing excess insulin. So in addition, it is important to understand that during early morning, around between like 2 to 4 or even like 2 to 6 a.m., there is increased production of these two hormones called as the cortisol and the growth hormone, and these hormones increase the blood sugar. So these spike in blood sugar varies between different ages. For example, in growing kids during the time of puberty and stuff, so these hormones are being increased and thereby causing an increase in blood sugar spike. However, when someone has a normally functioning pancreas, they will produce excess insulin to compensate for this increased blood sugar that comes from these hormones. So in summary, what we have seen so far is that there is always low levels of insulin that is circulating in our body at all times. So this makes sure that the insulin keeps a check on the liver so that the liver is not pouring extra glucose into the bloodstream. The liver also keeps a check on the fat tissues so that not too much of ketone bodies are being produced. Otherwise, everybody can go into the risk of ketoacidosis. So in addition to that, we have also seen that during increased stress and during food intake, our blood sugar rises, and a normally functioning pancreas will produce extra insulin to make sure that the blood sugar stays between 70 to 140 milligram per deciliter. So now that you understand how insulin works in your body, I would highly recommend to check out this video here where I talk about how eating too much sugar can lead to prediabetes and type 2 diabetes. The most important habit, basically health habit that can help with both type 1 diabetes, type 2 diabetes and prediabetes is exercise. I would highly recommend to check out this video here where I talk about how exercise can help with diabetes, and I'll see you in the next video. Until then, goodbye.